We are a year into this pandemic now. I'm hoping that one of the things that sticks around post-pandemic is telehealth, because we have seen that explode throughout this time, and it really is a needed, a needed option for so many people. As we continue into what we hope is going to be the backside of this pandemic. With us now to talk so much more, let's bring in Ewa I'm going to mess up your last name. Just go ahead and say it.
It's Matuszewski.
But it's great to have you with us. And, I love what you guys do there. But tell us more, for those not familiar with MedNetOne. Tell us more about the work that you do.
I think it's really important to lay the foundation about the transformation that we've undergone. We started out simply as an organization of physicians that were contracting with managed care organizations, and this is back in the previous century. But as we evolved and transformed, we began to identify areas where we really began to include patients into our work. So we do a lot of care management activities now, do an awful lot of telehealth, especially for the behavioral health side. And what started out as simply an idea has now really picked up and grown tremendously within our organization of close to 1,000 providers.
Do you think this is going to stick around post-pandemic? Because they had to tweak the rules and regulations to allow for this to happen, correct?
Yeah, they did have to tweak those rules to meet what we would call HIPAA guidelines, the privacy and the security guidelines. My only concern is access. We are talking about physical access to a physician or to a healthcare professional's practice. In our instance, there are so many people that still don't have access to Wi-Fi. They don't have access to computers, don't have access to healthcare professionals that might be bilingual. So that if you're only speaking Polish, for example, how would I be able to have that without having an interpreter with me? So we'll work through the kinks, but huge strides. The state has really gone ahead and stepped up to the plate as well. The professional societies are backing what we're doing in the telehealth world, and the payers are allowing for the telephonic support and the virtual support of patient care.
Ewa, I wonder, how do you guys help navigate this crazy world, the healthcare industry, which is so connected to the insurance world as well?
So you have to be adept, and you have to adopt. And there are days where you stop what you're doing and you pivot and move in a different direction. But there are some wonderful relationships that have been developed over the years with major payers, because they are truly caring about the community now. They're caring about the patients that are not only in their product, but also those that might not have access to the type of insurance that many of us have.
So we all know doctors, or if you have your own family physician, and it's been frustrating for them, just the change in the healthcare industry overall. Do you think this is going to be one way that at least they can check in on some of their patients that maybe they couldn't do so before? Just you only have 24 hours in a day.
Yeah, and I have to come out my due diligence here. I usually look and see what my husband does, because he is a family physician, and pretty much everyone in our world is in primary care. So true, there aren't 24 hours in a day, but telehealth isn't going to resolve everything. When you're ill, you want to have someone there physically sitting next to you. You want someone basically holding your hand. There are touches that occur in healthcare that will not occur in the telehealth or the virtual world. And that's pretty evident during the time of the pandemic, where you're bringing a screen into an ICU so you can at least see that person, but it's having that person sitting next to you, because you can smell them, you can see them, you can touch them. That just won't happen in the virtual world.
Yeah, and there are ups and there are downs to both sides of this world. How does this look with the insurance side when we're now doing more and more telehealth? Are the doctors getting paid for that? Because before, if I understand it right, and I know every state is different, they weren't necessarily getting their time compensated for telehealth visits.
That is correct, and that did change dramatically within a month of the pandemic coming into the world here. So in April of 2020, the insurance companies stepped up and said, you know what, we're going to be paying the same amount, reimbursing physicians the same amount for virtual visits as we have for those in-person visits. And that was really an important step for us because we were able to pivot very quickly and train our physicians on virtual physical exams. And so they weren't doing the exams, the patient was, but they were able to walk through the process of, you know, show me the, you know, the elbow, show me this, you know, go ahead, move the screen in closer. And so physical exams are actually becoming the state of the art acceptance these days.
Wow, it really is amazing how technology has changed our world. We're talking with Ewa Matuszewski. She's the CEO of MedNetOne Health Solutions. We're thinking, like, even if we went through this pandemic 20 years ago, we wouldn't be able to do all of this. I think we were still on the big cell phones, you know. Back in that time, definitely didn't have the pictures and the internet that we have now. Remember the AOL dial-up?
Oh, yeah.
Oh my gosh, could you imagine if that was happening now? But with that, can you talk to us a little bit more about the security measures behind the scenes? Because we do know that there are security issues and hacks that are happening now because so many more people are online. Has that been an issue within the healthcare industry or not so much?
So technically, we are very reliant on our EHR, electronic healthcare vendors. We depend on them to be our really good partners to ensure that the privacy and security standards are met. But with that being said, organizations like ours do periodic tests to make sure that our systems are unpenetrable. So there is a lot of that happening in the community. And I also have to mention that there still are quite a number of physicians that are on paper charts. The entire world has not moved to electronic health records. And I also have to come to the defense of those physicians that are using paper charts because their patient engagement and their quality scores are sometimes better than what we in the electronic world are able to produce. But I can say this, we always worry about that penetration because we have an entire history of a patient, longitudinal history, often from birth all the way through to end of life. And if you're a hacker, you can get some really good information from those types of records.
Yeah, so many people are after your Medicaid and Medicare number. I know that my primary care doctor, he's been electronic forever. He was one of the first doctors in the state of Michigan to go electronic. So he's been an advocate. But I will say it is a little bit nicer when they print off your paperwork because you can actually read it. When you guys are doctors, do they teach you how to give you a handwriting lesson in chicken scratch?
I think they do. I can say that having electronic health records has been a godsend, especially when you're looking at medications and the directions for medications. So from that perspective, we are absolutely thrilled that more and more physicians and healthcare professionals have moved into that electronic health world. And I have to add one thing here. We are very focused on primary care physicians and medical doctors. Right now, many groups are moving into doing some great work with behavioral health organizations to really have a whole person chart is so significant, especially now. You've got someone that's depressed, that has anxiety issues, or that has domestic issues. You can now take a look at that entire chart and be able to comment on it and even earmark it for future outreach, quicker outreach than perhaps in the past.
And Ewa, that seems like if you're a doctor, that's a great place to be because you're getting to see the entire patient. I know some doctors are even going where they're open now to more holistic revenues as well because they're trying to treat the entire patient. Do you think this is just going to be the way we start to operate going forward?
It's crucial to enter into what I call the patient-centered medical home model because you're truly looking at that patient in a holistic way. You're able to identify what their needs are, almost forecast what tomorrow will look like in their health journey. And many of us are looking at what we call upstream care. Let's go ahead and stop disease processes from occurring or speeding up. So let's stop them as quickly as we can and do an outreach to those patients for their diet, their nutrition, their exercise, and whatever else they might need, and envelop them with a team. Many practices now have very good teams of healthcare professionals right in their practice to work with those patients.
Ewa, if we could talk for a second just about the healthcare industry as a whole with more and more students. Like it seems that we are possibly here in the United States headed towards a crisis and getting enough qualified individuals to want to go into medicine right now, and especially diversification within those numbers as well. Your thoughts on that?
My thinking process always goes to the primary care community. We are in such need of, I call them the holistic individuals, because they treat the entire body. They are also able to go ahead and work with individuals through their behavior health crises, let's say. And it's the primary care physicians that we're missing. When you drive down the freeway and you look at a billboard, it tells you about urgent care and emergency rooms, and I've got the best heart surgeon, and I've got the best this and best that. It would be great to see billboards that say, you know, we've got really great primary care physicians. Start your healthcare journey there. And the more we focus on primary care, number one, the cost will be reduced because they're able to really provide whole person care, and then they know where to refer the individuals to for specialized care.
That's a great aspect to look at. I saw a 60 Minutes episode where they were looking at students that were going into medical school, and primary care was one of the areas that we are struggling right now as a nation, because it's not the high cost. We think doctors make all this money, but we have to understand the cost of medical school right now is just outrageous.
Well, and not only that, but if we're looking at what profession is really pushing those primary care practices, I have to say that the field of osteopathy, the osteopathic schools are producing more graduates that are moving into family medicine residency programs than the allopathic profession is. When I take a look at newbies coming out, it's really impressive to see the number of individuals saying, I've matched with the family medicine residency program, and I'm going to stay home. Michigan, the MSU-COM, Michigan State University College of Osteopathic Medicine, probably retains most of their students, more students than the other schools of medicine do in Michigan. So I have to throw out a huge thank you to them for really helping us support primary care.
That's great. Do you think we're going to get to the point where our primary care doctors are going to be able to administer the vaccine for COVID-19?
Oh, you know what? You're asking me a very loaded question.
That's not easy. I trust my doctor. I like my doctor.
So I have to come to the defense of both sides. My organization is a CDC-approved distributor of the vaccine. And we understand what the shortfalls are in the distribution process. It's easier to send to pharmacies or to send to, let's say, the local health departments, because it's a constrained place.
Right.
The pharmacies probably get theirs from the Federal Reserve. It's central to let's say, one pharmacy chain. They push it out to their pharmacies. We don't have such a process with physicians. Physician organizations do. If you were to say to me today, Ewa, I'm sending you 5,000 vaccines. Can you get them to your PCPs? I can say yes, because I would then not break the chain of distribution. I would know who's getting it, and I would be accountable for ensuring there was no waste. And that's why the way it's set up right now, it's just difficult for the government to do. And I wish they would have included primary care physicians in the planning and implementation phase, but that's behind us. We need to look at what we can do tomorrow. We're doing a lot of pop-up clinics. This week, We're doing a pop-up clinic for the Korean community in Northville. We're doing one for the Chinese community, and we have gone ahead and succeeded in working with a lot of at-risk communities to help them.
Well, Eva, we so appreciate all the work that you and all of your team members are doing to try to help keep us safe during this pandemic. Anything we didn't ask that you want to add before we say goodbye?
Yes, I would like to say this. If you have the opportunity of getting a vaccine, whether it's J&J, Moderna, or Pfizer, just unroll your sleeve and take it, because we need everyone to have that vaccine. It's for the good of all.
It really is. And I think it opens up to the public starting the first week of April. And so more and more people will start to get vaccinated here in the state of Michigan. We've been with Ewa Matuszewski. She's the CEO of MedNetOne Health Solutions. Thank you again for your time. We so appreciate it.
Thank you.